Hi everyone, today's video will discuss manipulative body-based medicine. Let's get started. What are complementary and alternative medicines?
Complementary and alternative medicine, CAM, is the term for medical products and practices that are not part of standard care. Standard care is what medical doctors of osteopathy, and allied health professionals, such as nurses and physical therapists, practice. Complementary medicine is used together with standard medical care. An example is using acupuncture to help with side effects of cancer treatment. Alternative medicine is used in place of standard medical care. An example is treating heart disease with chelation therapy, which seeks to remove excess metals from the blood, instead of using a standard approach.
Manipulative and body-based practices fall under the overarching topic of complementary and alternative medicines. According to Brainline, the National Center of Complementary and Integrative Health, manipulative and body-based practices focus primarily on the structures and systems of the body, including the bones and joints, soft tissues, and the circulatory and lymphatic systems. Practices include chiropractic and osteopathic manipulation, therapeutic massage, and other bodywork therapies. Have you ever heard of acupuncture, massage therapy, reflexology, tai chi, or yoga? These are examples of popular manipulative body-based practices. Historically, the use of manipulative body-based medicine can trace its origins from parallel developments in many different parts of the world where it was used to treat a variety of musculoskeletal conditions, including spinal disorders. The earliest historical reference to the practice of manipulative therapy was in Greece, which dates back to 400 BCE. Some practices were derived from traditional systems of medicine, such as those from China, India, or Egypt, while others were developed within the last 150 years. Over the centuries, manipulative interventions have been falling in and out of favor with the medical profession. Manipulative body-based medicine can be used to treat pain, stress, anxiety, and depression, and for general well-being. Since its use for a variety of musculoskeletal conditions, practices have evolved through increasing recognition of the mind-body connection, growing research, and integration into modern healthcare, especially for pain management and rehabilitation. Some short-term effects of manipulative body-based medicine include pain and discomfort. After treatment such as spinal manipulation, temporary side effects such as headaches, muscle soreness, or fatigue are common. These discomforts are usually localized to the area of the body that was treated. Another example of short-term effects is minor injuries, where in massage therapy, for example, some individuals may experience minor bruising or discomfort, particularly if the treatment is too forceful, especially for those with sensitive conditions. Long-term effects of manipulative body-based medicine include serious injuries, such as cervical artery dissections, CAD, from spinal manipulation, especially on the neck. This is a rare but serious risk. It can lead to strokes. Although this is uncommon, any sudden neck movements, whether during manipulation or in activities such as sport, can trigger these tears. So, even though CAD is not a direct result of manipulation, it can happen with the help of external factors such as physical activity. Non-medicated therapies, otherwise known as complementary and alternative medicine, are becoming a more supportive care option. Commonly used therapies, reflexology, osteopathy, or chiropractic care, come under the heading of manipulative and body-based practices. However, the scientific evidence of their effectiveness is still unclear. Manipulative body-based medicines, such as chiropractic care, osteopathy, and various forms of physical therapy, involve the manipulation of the body's musculoskeletal system to improve health and alleviate pain. These approaches interact with human biology in several ways: spinal adjustments, chiropractic, joint mobilization, osteopathy, nervous system regulation, and pain relief. By adjusting the alignment of the spine, practitioners aim to relieve pressure on nerves, reduce pain, and improve the overall function of the nervous system. Proper alignment can help in preventing chronic conditions and pain associated with poor posture or injury. With joint mobilization, techniques used in osteopathy focus on restoring the mobility in joints, which can help reduce stiffness, improve flexibility, and reduce inflammation in areas of dysfunction. Manipulative body-based medicines interact with human biology primarily by addressing the structural aspects of the human body, which can have cascading effects on the nervous, circulatory, and immune systems. The result can be improved pain management, enhanced healing, and better overall function. More commonly used manipulative body-based therapies include reflexology, osteopathy, and chiropractic care. Reflexology, by the definition of Better Health Channel, is a form of complementary therapy which, through the massage of the feet, aims to promote wellness in other areas of the body. Did you know that according to the philosophy of reflexology, all the organs, glands and parts of the body have representing reflexes on the feet? Osteopathy is the focus on the whole body, including the soft tissues, such as muscles, ligaments, and tendons, the spine, and the nervous system, and may use a variety of different hands-on methods including spinal manipulation, soft tissue massage techniques, and articulation, which is gentle rhythmic joint movements. Lastly, chiropractic is derived from the Greek words chair, meaning hand, and practicos, meaning done, namely done by hand. Chiropractors are primary contact practitioners, which means that they can see patients without a referral from a GP. They focus on treating the spine by using their hands to examine and treat health conditions related to the bones, muscles, and joints. The National Library of Medicine, NI, wrote a systematic review evaluating cancer patients' benefits in oncology with the use of manipulative and body-based practices. NI found 1,624 articles, 41 articles were included, 24 articles were about massage, 11 about reflexology, and 6 about acupressure. Overall, 25 studies showed positive and significant effects on symptom outcomes, versus 9 that did not, especially pain and fatigue. There were mixed outcomes discovered for quality of life, 8 papers found a significant effect while 10 did not, and mood, 14 papers vs 13. In most of the studies, there was a high risk of bias with a mean JADAD score of 2. A JADAD score is a widely used scale for deciding how internally valid a trial is, making the interpretation of results difficult. Manipulative therapy was initially the mainstay of the two leading alternative care systems, osteopathy and chiropractic. With medical and osteopathic physicians introducing manipulative therapy to the profession of physical therapy, physical therapists have since then provided strong contributions to the field, thereby solidifying the profession's claim to have manipulative therapy within its legally regulated scope of practice. Hippocrates was the first physician to describe spinal manipulative techniques using gravity for the treatment of scoliosis in his Book of Joints. He described the use of a table with various straps, wheels, and axles enabling traction to be applied. The hand, foot, seated body weight, or a wooden lever could then be used to impart spinal pressure, or thrust to treat a gibbous or prominent vertebra. This work of Hippocrates was referenced by both Claudius Galen, a noted Roman surgeon, and Avicenna, known as the Doctor of Doctors. This contributed greatly to the emergence of Western medicine at the end of the Middle Ages because of their scientific writings and discoveries.